The final objection I'm going to discuss today is the coerced intervention, or having somebody put in treatment against their will. You know, in the video before this, I talked about how the silent killer was the DIY intervention, which is still true. But nothing is more devastating or detrimental to your family and your loved one than you trying to do the job of a highly trained clinician and following the protocol of a coerced intervention. The last thing a family should ever do is have their loved one taken against their will. And before I get into some of the clinical reasons why you shouldn't do that, let's talk about some of the common sense reasons. Addicts, alcoholics, people with mental disorders are notorious for pointing fingers and blaming everybody else for their problems. When you coerce and forcibly put your loved one in treatment, how do you think they're going to perceive that when they're there? Are they going to be there because they went with any type of therapeutic intervention or any type of their own thoughts or consequences? They're going to be there because of you. No intervention in the history of this organization is more difficult to overcome than the family that calls us about their adult loved one who they had taken against their will to a wilderness program in their teens. No intervention in this organization is more difficult than a family who has had their loved one taken against their will at any point in their lives, adult or minor. When you guys start talking about having them forced against their will, that is the job of professionals. If you look at all of my objections, combine them and throw them out the window compared to this one objection. This is the one where I'm going to tell you, if you want to give me excuses, fine. You want to give me objections, fine. I'll live with all the other ones. I know the meaning behind why you're using them and the fact that you're hiding behind them, but that's okay. This one here, stop. Do not coercively bring your one to treatment thinking that you just did something that was going to be therapeutic and effective. So I want to just read a couple of things, and this is on our website underneath the excuses of why families don't intervene section. So one of the most important things that I'm going to read you is from one of my textbooks in school. I have the citation on the website, and it quotes, "Involuntary interventions," in other words, you thinking you're going to force your loved one in, "take away clients, your loved one's self-control, and both involuntary and coerced interventions can and will undermine clients' motivation. And since motivation and self-control are strengths that dual disorder treatment aims to cultivate, the use of involuntary and coerced interventions require particular care." And I also have two more things I wanted to discuss. And again, this is on the website, but it's so important that I put it on this video and read it verbatim per the citations. And again, the citations for these sources are on my website. "A coercive and involuntary approach is justified when three things are met. Rules. The involuntary commitment would prevent the harm to the person is so great that the person cannot rationalize the alternative. The person does not have a reason to suffer the harm for involuntary commitment tries to prevent. And the harm will occur to the person if the involuntary commitment is not performed, and it will reduce the likelihood that the harmful act will occur. And those justifications or those rules are dependent on these four scenarios: the seriousness of the harm to be avoided, the extent of the person's rational responsibility, the likelihood of harm, and the likelihood the involuntary intervention will diminish the chance of harm." And, you know, guys, when you go through all that stuff, and I know some of you are like, yeah, they're doing all that. I don't disagree. You cannot put somebody in treatment against their will unless you have a professional present, a court of law, or some type of person, maybe the state you're in has laws like Florida with the Baker Act. So whatever you do, if you want to use objections and excuses, if you want to do your own intervention, although ill-advised on all that, the last thing I want anybody doing is thinking that they're going to go in there and they're going to go through the motions and just drag their loved one into treatment or use some type of method that is not evidence-based to force their loved one into treatment through a coerced intervention. Please, if that's your route, stop.